so today we're going to look at the Vectrogenesis, and it's a combination electrotherapy and ultrasound machine. And for this second round of competencies, we're going to use it as an electrotherapy machine. So you want to make sure that you pull the bottom panel off and the electrodes fit into the two channels in the middle. So the one on the left would be the first channel and the one on the right would be the second channel. Make sure you have the correct electrodes that fit the machine. All right, and then just to go through to program it, you would hit electrotherapy, and for your case studies, most of them with the Vectrogenesis, you're either going to use the inferential setting or the Russian setting. So you want to go back to your textbook on page 163 and reread the information on interferential and Russian stimulation and the difference. They're both fairly used widely in the clinic. I personally prefer the interferential because it's better tolerated by most clients. The Russian stimulation can be a bit painfully perceived by some clients. So, you know, you may get out there and practice and see which one you prefer for different conditions. So, if we're going to program interferential, you hit the interferential button, and then everything is pre-programmed. You can edit it if you want. You know, you can edit some of the settings, but it's preset already to use inferential. So if you want to leave it on the pre-settings, you can. And then if you want to back up and choose Russian, it also is preset for Russian, so you can see the settings there. You know, if you choose to use that one. So we're going to go back to interferential, and if you look at the face of the machine, interferential means that you have 4 electrodes and they're positioned so that their signals interfere with each other. And so, for example, you would have one set of electrodes crisscrossing the other set of electrodes. So that's how your electrodes need to be placed. All right, so I'm going to put it on inferential, and then we're going to connect up our electrodes. And we're going to assume for this video that we've already cleaned the area of the skin with the alcohol Rex. All right, so we're going to crisscross our electrodes. So we may have one there, and then here. And with interferential, the current's going back and forth, so you don't necessarily have a positive or a negative electrode. And then with the second channel, you also want to crisscross your electrodes so that you're getting where they cross would be the area that you're wanting to treat. All right, so you know, remember, the closer together your electrodes, the stronger the signal and electricity. All right, so now we've got all the electrodes attached, and this is not for stimulating muscle contraction, and this is more for interference with pain. So we are going to go ahead and start. All right, and you want to actually set the intensity before you start. So I'm going to try 1.5. You really want to get it to where you feel some tingling.
Very little.
All right. So we're gonna turn it up till you feel some tingling. Just let me know when.
Yeah.
Okay. So just turn it up slowly, watch their face, listen for any vocalizations.
Okay.
All right, so that's when you're just beginning to feel it.
Mm-hmm.
All right, so I want you to tell me at what point, the highest point that you can tolerate that's comfortable.
Okay.
All right. And is it sort of pulsing?
Yes.
Okay.
Mm-hmm.
That's what it should feel like. It should be like burst or pulse. And keep going.
Yeah,
Okay.
that feels good right here.
Okay. All right. So we're up to like 9.4. That's going to be different for different people. But you can leave it running for, 12 to 15 minutes. We started at 20 minutes. That's fine. And this will help modulate their